Hey everybody, Christopher Wellwood here at the Natural Health Center in Medical Lake. We had a Facebook request for a video on shoulder pain. Now, this is actually a pretty difficult topic to discuss within a very short period of time. For one, shoulder pain could be due to any number of things, and two, it's pretty much an individual issue as far as what we need to be doing as far as treatment. Today, what we'll do is we'll talk about common causes of shoulder pain as well as what you can do. If you'd like some video on exactly how I treat shoulder pain, specifically shoulder arthritis or bursitis, you can reach an individual video that I've posted on my website for northidahopain.com/gallery, and you can see a results video where we literally took a patient who couldn't move their arm much at all, and then they had full range of motion after an injection of Prolozone. Today, what we'll talk about is common causes of shoulder pain as well as potential treatments for it. Now, one of the most common things that we see here is calcific tendinitis. Calcific tendinitis is a repetitive issue where a person continues to do one specific thing over and over and over again, and that is cause an inflammatory reaction, which then basically promotes bone growth within the tendon itself. Once it gets to the bone growth within the tendon, it's very difficult to treat. Oftentimes we need to send out for a surgical fix, so they actually chip away at it and they take the bone out. However, if it has not gotten to that point yet, we oftentimes do shoulder stabilization exercises or general chiropractic manipulation into the shoulder itself in order to increase motion. We can also do some massage therapy along the tendon and muscle to relax it so that it stops aggravating it and causing inflammation. Obviously, the most important part for calcific tendinitis is actually stop doing what you've been doing or change the way you've been doing it. Other things you can do are taking anti-inflammatories, supplements such as curcumin or bromelain. Those are two of my favorite that help with inflammation. Other causes of shoulder pain could be glenohumeral joint instability. That's basically where it's been damaged to the point where your shoulder keeps popping in and out over and over again. To treat that, we actually manipulate it however it needs to be as far as chiropractic goes, and then stabilize it with some exercises. Another cause would be the general sprain and strain of the rotator cuff itself, and when that happens, you'll get some inflammation along the top as well as the back and sometimes down the front of it, and we treat the inflammation with laser therapy, heat therapy, cold therapy, general range of motion exercises, or we send off to our occupational therapist in the office here to do some ultrasound and electrical stimulation as well as some strengthening and stabilizing. One of the main concerns that we see here is biceps tendonitis, which is very much like repetitive injury syndrome, but it could be due to some type of trauma. We see a lot of it here for baseball or golf even, and sometimes tennis with doing the overhead activities. Biceps tendonitis can be due to an abnormal shoulder being forward, which is causing pressure on the biceps tendon as it goes to the shoulder area itself. And if that's the case, we just manipulate it back, and we manipulate the top of the shoulder back, and it feels much better, and you're good to go for another 6 or 8 weeks or until you injure it again. One of the uncommon things here, I shouldn't say uncommon, but one of the more difficult things to actually treat is a shoulder injury or shoulder pain due to a cervical condition. That would be a lower neck problem. Now, 80% of all shoulder pain is actually due to neck issues. Now, part of the problem there is our posture is so poor, but also we could have had some type of trauma or whiplash issue in the past. It could be due to muscle spasticity. And what we like to do here is doing postural examinations, not the curvature type of postural examinations, but what we call sway patterns. And sway patterns can tell us how well our brain is actually coping with different positions. Now, one of the things you can do to determine if you actually have a sway pattern issue is just standing up nice and tall and keep your head straight but then look down. And normally you should actually move a little bit forward. If you look up with your eyeballs, you should move backwards. If that does not work for you, then you have an abnormal brain position. And that abnormal brain position is more often than not forward because we've had some type of trauma or injury and our brain thinks it's falling forward all the time. When it thinks it's falling forward all the time, the chiropractic physician actually has to correct that behavior, and we can do that by actually adjusting the shoulder, the elbow, the wrist, or even doing some auditory stimulation or some vibration in order for your brain to think and understand that it's not actually falling forward. Now, the end result of that is that it will reduce the muscle spasms in the back and the upper neck area. It will reduce headaches, which are pretty typical with that as well, but then it will also reduce the shoulder pain. Now, this should only be done by a qualified chiropractor, as that can really screw you up. So that would be somebody who is educated in functional neurology, or somebody who is a board-eligible chiropractic internist, or board-certified chiropractic internist, of course. Somebody who understands brain and positional awareness. At this office here, I focus on something called neuroendocrine chiropractic, which combines hormonal treatments and with inflammation, typically from the adrenal systems, as well as brain-based conditions. So I hope that this short video has helped you out a little bit and given you a little bit more information on exactly what is it you can and cannot do, or to help for the future treatments. If you'd like any more information, please don't hesitate to post on my Facebook page or reply to this video, and I'll be happy to reply to you as well. Or you can reach me at my office in Medical Lake, which is the Natural Health Center, at 509-299-6900. Have a good day.